Okay, I thought that the Novocaine shot was the worst part of the process to me.
When you were receiving or afterwards?
Well, all of the above.
The whole
Only
thing.
for an hour afterwards did I feel bad, and then I felt no pain.
Well, it's a bit of a blessing and a curse, because I assure you it would have been a worse experience.
Yeah, I'm
without
sure.
any anesthetic.
Especially the cauterizing.
Yeah, you should only feel that first injection each side, because once we create, like a wheel of local anesthesia, then I'm re-injecting to that spot. So it's the same needle we use for Botox, so it shouldn't be worse than Botox.
Okay, so how many pricks was it per eye?
3 to 4, but you should really only feel the first one.
Okay.
On each side. And the other thing is, within that, it's not just local anesthetic, there's also epinephrine in there, which is what constricts the blood vessels, it stops bleeding, it's going to limit the bruising.
Right. How long from start to finish? Let's do each eye. I in my mind, I think it was like 12 minutes per eye.
Well, it's probably a little bit...
I'm going to ask you a question for me.
Sure.
Mine was done totally awake, but you can choose to be put under. Can you just explain how easy it is to be awake? Why you like people awake without being tranquilized or taken a Valium versus being put to sleep?
I like patients either to be totally awake or totally asleep, because if you're awake but you've taken some sort of sedative, then you can no longer really participate if we're trying to say, can you just try and stay still, or can you move your head slightly to one side, or then if you doze off and you suddenly jolt, so you either need to be completely able to comply with what's going on or completely out of it, in my mind.
Okay, and for a lower bleph, you are always asleep.
Yeah, for me, always asleep, just because we're working on the inside of the eyelid a lot of the time, very close to the lid margin. Put a stitch to anchor the lower lid sometimes in the corner, and all of those maneuvers are, I think, difficult to do with a patient awake. So sometimes if the brow's sitting a little bit low, but it's not worth doing like a coronal brow lift where you're making an incision here, you're lifting here, or you don't want a direct brow lift where you're making an incision there that's visible. I'll do what's called a browpexy. So through that incision, that upper lid incision, I'll just suture or anchor the brow to the orbital rim, the periosteum, the lining of the rim, and that will just stop the brow from pulling down and just anchor it in an ideal position.
Okay, so while you're doing the upper bleph, you'll do that little tacking bit that gives you kind of a mini brow
lift. I
lift.
do that a lot of the time on men, actually, because I think when just men's brows tend to sit a little lower, and then when you take that excess skin, you don't want to pull the brow down further. So just anchor it.
Yes, that makes a lot of sense.